Have you ever thought about what would happen if your body's own energy pantry was locked from the inside? Well, that's exactly what we're diving into today with Glycogen Storage Disease, or GSD. It's a rare genetic condition that does just that. We're going to break down the telltale signs, the chaos it causes inside the body, and the incredible ways it's managed. Let's get right into it.
So, first things first, what exactly is glycogen? The easiest way to think about it is like a pantry for your body's energy. After you eat, any extra sugar gets stored away as glycogen, mostly in your liver, all ready for when you need a quick energy boost. But with GSD, that pantry door is, well, it's broken. The energy goes in just fine, but the special key, the enzyme that's supposed to unlock the door and let the energy out, it just doesn't work. And that one simple problem kicks off a huge cascade of issues all throughout the body.
Okay, so if the problem is a broken pantry door on the inside, how does that actually show up on the outside? When a doctor first meets a child who might have GSD, there are a few classic telltale signs they're trained to look for, little clues that point to the bigger story happening within. These first clues really start to paint a clinical picture. You might notice the child has a short stature and what's often described as a doll-like face. You might also see that their skin is quite pale and they bruise very easily. But honestly, the most striking sign, the one you can't really miss, is a swollen, protruding belly. And that swollen abdomen points directly to the heart of the problem. And the reason for that swollen belly is what's happening inside. The real drama is a massively enlarged liver and enlarged kidneys. See, they're just getting packed full of all this glycogen that they can't process or release. In medical terms, we call the enlarged liver hepatomegaly and the enlarged kidneys nephromegaly. Now, to really get a handle on the biochemical chaos GSD creates, there's a simple but really powerful tool clinicians use. It's called the 4-hypo/4-hyper rule. It's a great way to categorize the mean imbalances. Hypo means too little of something, and hyper, you guessed it, means too much. Let's break that down.
All right, let's unpack this. On the hypo side, the too little side, we have hypoglycemia. This is the big one. Dangerously low blood sugar, all because the body can't access its stored energy. This can lead to hypotonia, which is low or weak muscle tone, and it can even affect mental function. We also see a hypocellular bone marrow, which just means it's not making enough blood cells. Now on the hyper or too much side, we've got the enlarged liver, hepatomegaly, which over time raises the risk of liver tumors or hepatomas. The body's metabolism is also going haywire, churning out high levels of uric acid and cholesterol.
So, these core problems, they don't just stay put, not at all. They set off a massive domino effect, creating a ripple effect that touches pretty much every system in the body. And here's that ripple effect in action. Remember the weak muscles we just talked about? Well, that can lead to breathing difficulties. The heart is a muscle too, so it can weaken, which is a condition called cardiomyopathy. The blood gets hit hard. Low platelets are what cause all that easy bruising, and low white blood cells mean the body can't fight off infections very well. The kidneys are also under a ton of strain, which can cause high blood pressure and kidney stones. So as you can see, GSD is truly a full-body, systemic disease. So, with so many different symptoms affecting the entire body, how do doctors figure out that GSD is the actual culprit? It's like a medical investigation, a step-by-step process that moves from simple observations to some very specialized tests. It all starts right at the bedside, with basic checks, like blood pressure and, crucially, blood sugar. Then come the lab tests, which will show all that metabolic chaos we talked about, the high uric acid, high cholesterol, low blood cell counts. Next, an ultrasound can physically show the enlarged liver and kidneys. But the final, definitive proof, the smoking gun if you will, comes from either an enzyme assay or a liver biopsy. These tests directly look at the faulty enzyme and confirm that the pantry door is, in fact, broken. Okay, so once the diagnosis is confirmed, the entire conversation shifts. It goes from, what is this, to, okay, what do we do now? For patients and their families, it's really about learning to navigate a completely new normal. And the absolute foundation of managing GSD comes down to one single, non-negotiable rule: avoid hypoglycemia. Seriously, preventing those dangerous drops in blood sugar is the #1 priority. It's the key to managing the whole disease and stopping its worst complications in their tracks. So how do you actually do that? This slide is so important. Management is all about providing a constant, steady supply of glucose, often through things like overnight tube feeding. A really cool tool they use is uncooked cornstarch. Believe it or not, it acts as a super slow-release form of sugar. In an emergency, they'll use IV dextrose.
Now look at that avoid column. This isn't a suggestion. It's a critical life or death warning. In a normal low blood sugar emergency, you might give a glucagon shot. But in GSD, that is a huge mistake. The liver can't respond to it, and it can actually make things much, much worse.
But managing GSD is about way more than just blood sugar. It's a whole body approach. That high uric acid, there's a medicine for that called allopurinol. The high cholesterol, statins can help with that. Lifestyle changes are also a huge part of it, like being careful to avoid injuries because of the easy bruising and staying away from crowded places to avoid infections. It really does take a village, with a whole team of specialists and genetic counselors supporting the family every step of the way. Now, while all that daily management can control the symptoms, there is one treatment that offers a potential cure: a liver transplant. By replacing the liver, you're literally replacing the source of the broken enzyme. You're hitting a reset button on the body's entire metabolic system. It's obviously a huge step, but for many it is absolutely life-changing.
And that really brings us to the future. A liver transplant is a massive intervention. But what if we could fix the broken pantry door without having to replace the whole pantry? With all the amazing advances in things like gene therapy and enzyme replacement, are we getting close to a cure that can fix the genetic mistake right at its source? That's the big question driving researchers today. And it's a question that holds an incredible amount of hope for everyone affected by GSD.